Finally.
Do you see me, guys?
There.
Don't blame me. I have to be a little bit outside, but it's a private garden. I'm not breaking the rules.
Okay. Okay, great.
Still,
Finally. I'm glad. I'm glad we're on.
How are you? Good?
Good,
Just try to
good.
get the best connection possible.
All right. So why is so right now you're getting your you're not using Wi-Fi anymore. It was a poor Wi-Fi issue.
No, actually, you know, in my residence, I'm currently here in Dubai. The Wi-Fi for some reason was not so good, but I want maybe just to apologize to show you our friend Burj Khalifa. I don't know if you are able to see it.
Right.
I'm outside, but I'm still in a private place. This is the garden of my residence.
Okay.
So the stay home message is respected. How are you, my friend?
Good. Can be better. Can so
you well now?
What's that?
Do you see me correctly?
Yeah, I do.
You see me correctly?
We do. Yeah. Okay. It's fine.
So what did you discuss so far?
Well, I was talking about you, and then we talked about things I wanted to discuss about. Talked about the situation here. So tell us, what's the situation there?
Well, I'm going to give you, you know, the comparison between Paris and Dubai, because being French but living in Dubai, I was able to see quite some, you know, a bunch of differences. So first of all, you know, in France, like in Spain, Italy, we are more Latin style. So there is more panic. Here in Dubai, it's very quiet. You know, there is no big announcements. Everybody is respecting the rules. We don't see, you know, the ruler of Dubai like Macron on TV. We are just receive in our phone or on, you know, on social media some instruction, and everybody is following it. So there is, I would say, a 99.99% of compliance in terms of, you know, restriction respect. This is number one difference.
Right.
Number two. Number two, I would say there was you know, a delay between, you know, the restriction in Europe and Dubai. I would say up to April 4th, so just, you know, 8 days ago, life was quite normal, not normal, subnormal, but we were able to go out, we were able to run outside, and suddenly on Saturday, 4th of April, we received all in our phone. I remember it was at 8 p.m. Total lockdown, 24 hours, and even more strict than, for example, in Europe, because at least in France, because we were not able, for example, to go and run outside. And so now this is a situation. It's for 2 weeks, so up to April 18, and then let's see what's happening if there is an extension, like in Europe up to late April, or if we are starting, you know, the containment from April 19th. Let's see. I think it will be extended. Yeah.
Okay. Right. And the compliance, you're saying that in Dubai they were really good. How about in France? Do you think the compliance was bad in France?
Yeah, actually, you know, now this is Easter weekend, and apparently the weather is good in France, and everybody wanted to breathe outside, and especially, you know, the joggers. We saw some pictures from Paris, you know, with you know, empty streets in terms of cars, but a full street in terms of joggers, like if there was a marathon. So
oh my God,
a bit a shame.
Oh my God,
a shame.
Yeah.
But but now there is a restriction from 10 a.m. to 7 p.m. So we are not people are not able to go and run. So
now it's more like a curfew, right? So now it's more like a curfew. They sort of lock down totally in France.
Well, it's like a curfew, and if we want, sorry, I'm moving a little bit because the Wi-Fi starts to be bad again. It's not really a curfew. You can still go out, you know, with mask, gloves, just for a grocery and pharmacy.
Yeah, I see you. That's in Dubai, right?
Do
Dubai,
you see
you
me or
have to
not?
wear mask. I do. Can you hear me? Can you hear me?
Okay. Yeah. I'm trying to move a little bit because outside it's already very warm and I start to sweat a lot.
Okay.
So I'm coming back inside just
Okay.
to avoid sweating in front of our
All
auditors.
right.
Yeah, please.
Okay. So there's a question for you. Why do you think that Europeans are
Tell
so
me.
cavalier about the restriction?
Yeah, because this is a Latin style, my friend. You know, I'm French and Italian, so I'm sure that in France I will behave maybe differently. But here in Dubai, I just follow the rules because if you don't follow the rules in Dubai, you go either to jail or to the airport or both. So there is no debate.
Right.
You know,
Right.
everybody's more calm here, and even myself, I include myself.
Right.
People who
Okay.
knows me know that I'm a little bit, you know, active and with
Right.
strong energy. But in Dubai, you know, you have to calm down, otherwise you have problems. So you just respect
We can.
the laws, you
Okay.
know, the instruction, and that's it.
Right. But because if you look at how is it happening in France, you have about 130,000 cases. You have more than 30,000 deaths, and 6,000 over people who are in serious condition.
Yeah.
Isn't that a panic situation? Shouldn't people be worried about and everybody staying home? No?
Yes, I agree. But you know, it's now I think 4 weeks in France that there is this containment. People start to have difficulties to stand it. And
Right.
we have to say also, we have to mention that the containment is not so good also for health. You know, we need to breathe, we need to get a bit the sun, the vitamin D, etc. So there are consequences.
Right.
I mean, we are doctors, so let's speak about a little bit medicine. Containment is bad for health. So I think
Right.
after 4 weeks, we have people. I mean, it makes sense. We can understand that they want to go out, and now Easter weekend, long weekend, beautiful sun in Paris. Everybody wants to go outside. This is normal. I can
Okay.
understand.
So
Yeah.
yeah. So how long do you think that whole thing will drag on to?
Well, since the beginning, you know, if you look China, I have in mind May 15th. Since the beginning,
Right.
so it's not necessary. You need to really expect April 15 or April 20 or 25. We all know that
Right.
the containment will be
Up to May, yeah. Oops, you are breaking out again.
here in
Right.
Dubai. You know, we are now April 12th, so in 2 weeks we'll start the Ramadan for 1 month.
Yes.
And then
Yes.
summer for 3-4
Right.
months. With Corona, with sequence
Oh, you're
Corona,
breaking out
Ramadan,
again.
and
Man, I think
summer
you have to move
temperature.
outside a little bit. Yeah.
There is nothing, you know, expected normal before September, I think. Yeah.
Right. And for Ramadan in Dubai, so you're gonna stay there until summer, right?
I mean, so far, you know, I'm sharing my time between Paris and Dubai. I should have been in Paris in March, but I decided to stay in Dubai. I should have been in Paris in April to work because I'm more or less 8 to 10 days per month in Paris, but I decided to stay in Dubai. And so far, I'm staying here because I feel, you know, more safe, more relaxed. I have the possibility where I am to go outside a little bit because we have a private garden, so I can breathe. I can even
Right.
work out, respecting the social distancing and all the you know, the restriction. So I'm better here in Paris. I will be in an apartment, stuck in my apartment without possibility to go out. So so far I'm in Dubai, and I don't expect to go back to Paris maybe before I don't know, June, I think.
Right.
Let's see.
They still allow you to go out to have a walk and everything.
No.
They are very.
No, it's more strict. Now it came later, more progressively. I told you before April 4th, it was quite possible to have a normal life. I was going outside,
Right.
you know, without mask, running 2 hours. And then suddenly we received, you know, on our phone, April, I tell you, it was Saturday 4th at 8 p.m. sharp. We received the message. total lockdown, all the restriction, and especially, you know, the one that was, you know, preventing people to go outside and run, because everybody wants to run, to exercise. And I am in downtown Dubai, you know, close to the Khalifa, Burj Khalifa, fountains, Dubai Mall, and a lot of people were, you know, running around the fountains. So it was okay. It was even fantastic condition, because there was not a lot of people, not crowded. So the, you know, the resident of the downtown we were enjoying something very special. You know, I was quite not happy, but I was kind of enjoying a little bit this very special situation. But now it's not possible. So instead of turning around, you know, the fountains, I'm turning around, you know, the garden. So the circle is much smaller, but it's okay.
Okay, right, yeah. Just try to be safe. Here we couldn't even go out. Yeah, we try not to. Our part to do.
So Kim Song, I just want to complete a little bit the situation in Dubai and UAE. So I had a last review this morning on the numbers. So I want to give you the current numbers in UAE. So UAE has 9 million of people. 5 million are in Dubai. Okay. So I'm going to speak for all UAE, not specifically Dubai, but basically Dubai is half of UAE, and the rest Abu Dhabi, etc. So so far 4,000 cases reported with a COVID test positive, 4,000, and 20 deaths. So it's nothing compared to Europe.
Europe,
Number one. Number two, before April 1st, there was quite no case. I think there was less than 50 cases. And we see, as everywhere, this exponential curve. So suddenly there is a break, and it's very vertical. So now, as everywhere, the cases are doubling every day. And yesterday was quite 400 new cases. 400 new cases, and more or less four deaths per day. So this is the situation. Number three, very important point. Since the beginning, since like 3 weeks ago, we noticed that the number of tests for the population was probably the highest in the world in terms of tests per million. So I remember 3 weeks ago, there were a ratio of 13,000 tests per million of people. And now 3 weeks after, it's 70,000 tests per million of people. What does it mean? It means 600,000 tests for 9 million of people. 7% of population of UAE have been tested. It's huge. And apparently this is the highest ratio in the world so far. So since the beginning, UAE reacted in this way by a massive testing. And we all know that the COVID came from the airport. So DXB airport was quite very well checked since the beginning. So it might explain these good numbers. But let's see how it will be now in the next 1 or 2 weeks. Are we going to see really, you know, a big increase of the curve, or is it to stay lesser than in Europe? I don't know, but well, let's see. The test, you know, strategy has been radically different. UAE has invested massively in tests, and it's continuing.
That's good. They have the money, and they're willing to spend that money to be vigilant about it. I think that's really good. But the thing is, now every industry is closed down, and we know even in whole UAE, probably a big part of population they come to work in or they come to work in. So we know that we know that there's a big population of foreigners in Dubai and in UAE.
I can give you the number. 89% of population in UAE is from abroad. So only 11% of local peoples. So you see.
Exactly. So when they shut down, what happened to all these foreigners?
Well, you know, the two biggest population in UAE, first Indians, number two Pakistani. Then when it comes to Europe, Russian, English, and French. We are 22,000 French in UAE. And I will speak mainly for French people. So most of us, sorry, we decided to stay here. So, and I don't know, you know, really French expat living in Dubai who came back to France. We have some, of course, some tourists. And personally, in my building, in my residence, I met few guys like this from France, but also from other countries, some Spanish, Italian, and they, despite the fact that there were some, you know, flights back to Europe, they decided to stay here. So I would say that the general tendency is more to stay here because we feel safer, and especially, you know, calmer. It's quieter here. We don't feel the panic. It's just so very quiet. That's it.
Yeah, but how about, because you guys are and those who don't get paid, are they getting paid in this 1 month of September?
I don't hear you very well, Tim Song. I'm sorry.
Okay, those who are working here,
yeah,
and because of the close down, the lockdown,
yeah,
do they get paid for it?
Oh, no, there are
many.
No, the politics here, you know, is completely different than in France. You know, in Dubai, you don't work, you don't stay. It's completely different story, you know. That's why, for example, the population in Dubai is much younger than everywhere else in the world, because after 65, except if you are very rich, you buy an apartment or you pay, you know, something to stay in the country, you can't stay. You know, there is no retirement help like in Europe or in other countries. So 65, you don't work, you leave the country. So if you don't work in Dubai, what does it mean? It means you are not able to stay. Here, the situation is that companies are proposing to their employees many unpaid leaves. And as everywhere in the world, yeah, many people are not able to go and work. And for example, the biggest company here is Emirates. Apparently, I don't know exactly the number, but 1/3 of expats here are related to Emirates. So they are all blocked. And I know from some pilots and crew from Emirates that they are actually on an unpaid leaves moment. So this is the situation. In Dubai, basically, you are not helped for work. There is no guarantee.
Right.
So that's why I think after this big crisis, it's going to take time to recover. And only, if you are really well established in your work, if you have enough resources, you will be able to stay in Dubai. Because in Dubai, generally, the rule is there is no work guarantee. This is key. That's why before the corona, we were starting to see more and more people going back to their country. I will speak, for example, for French people after 1, 2, 3 years going back to France, because in Dubai, from one day to the other, you can lose your job without any meeting, just a letter or an email, one sentence, and that's it. So this is completely different spirit. There are many advantages to Dubai, but there are definitely also no guarantees, and this is specifically the case now in this crisis.
So there are a lot.
This crisis is going to make a natural selection, I think. It's not going to be able to stay in Dubai so easily right now.
So you must have a lot of people who left Dubai because of it.
Yeah, absolutely. I want to mention something regarding our practice. So regarding the medical centers, more or less everything was closed from March 26. So it's roughly 2 weeks plus. Okay, but there is a big difference, and this is a bit surprising, between Dubai and Abu Dhabi. You know that UAE are 7 Emirates. The 2 main ones are Dubai and Abu Dhabi. And for some reason,
Okay, I think your line is being unstable.
Do you see me now?
Yeah, okay, that's good.
And in Abu Dhabi, still there is a bit of work, you know, and especially, you know, in non-urgent care. You know, I was, you know, I'm plastic surgeon, so I'm speaking mainly of aesthetic medicine or plastic surgery center, and some of these centers are still opening. Then after, it's all about, you know, your sense of responsibility. If the doctor wants legally to go and work in the clinic, in Abu Dhabi, it's not, you know, prohibited. And I'm going to tell you, I know few surgeons with double license, Dubai, Abu Dhabi, taking their patient from Dubai to Abu Dhabi. Well, let's not judge that, but just to let you know that UAE has I mean, 7 different Emirates. And like in the States, you know, Emirates are managing their restriction by their own and a little bit different in this perspective. Yeah.
I see. Right. And do you think it's because the last population and they are not so worried in Abu Dhabi?
I'm sorry, I didn't get your question, my friend. Would you mind?
Yeah. Yeah. Do you think that it's why Abu Dhabi is that way because there's less population there?
I think I try to read on your lips. So you asked me if this reason between the reason between Abu Dhabi and Dubai difference was because of what? Because of the population or what? No.
Yeah, because of the number of population.
Yeah, definitely Abu Dhabi, as you might know, is much more calm and less busy than Dubai. Okay. DXB airport is one of the biggest in the world. This is not the case of Abu Dhabi airport. We know that Abu Dhabi is not very lively. You know, after 5 p.m., Corona or not Corona, there is nobody in the street. And there is much less tourists, much more locals. So maybe it was not so necessary to impose a more strict lockdown. It's one possible explanation, but I cannot tell you precisely because this is still a mystery. It should be more or less homogeneous in the whole country, and this is not the case.
Yeah, it's the same as in the United States, right?
Yeah, exactly. Depending on the states, you have some differences. Yeah, absolutely.
Right. And you were talking about the skin.
Yeah.
And do you see them over there still? Or now you close your practice, you don't see anything?
No. Now everything is closed since more than 2 weeks. So I'm not on the front line, but as you know, our patients, our friends, our colleagues, because we are doctors, we receive tons of messages. Doesn't matter your specialty. Doesn't matter your specialty. Hi, Dr. Matt, what do you think of that, of that, of that, of that? And I start receiving some question about some skin symptoms. And that's why maybe we will talk in the second part of the chat about this COVID skin, because maybe people wonder how I had an idea of getting interest into that. Well, it starts like 3 weeks ago. I started to receive 2 messages from patients, and they were having some, some rash. One like, a red rash, another one like urticarial rash. And they were both having fever. So I just said, without knowing anything, because at this moment, 3 weeks ago, we didn't know anything about possible skin symptoms in COVID. I just tell them, just be careful. If you have some, if you are coughing or if you have some respiratory problems, maybe you should go and get a test. And both few days later, get some cough and some shortness in breath, and both had a test and both were positive. So it was the start 3 weeks ago. And then I started to read, and I saw one first paper from EADV, European Association of Dermatology, reporting skin symptoms, and it was the beginning. And and now since 3 weeks, I'm following very closely the situation because, my friend, you are not on the front line, but in this situation, we have to go back to source. before being you a dermatologist or me plastic surgeon, we are doctors. And even I would say we are human beings. So, you know, it doesn't matter what is your background. You are, everybody is very welcome to give a hand. This is, you know, the humanity is a global community. And of course, they are the frontliners. But for the others, it doesn't mean staying, you know, at home without doing nothing. So personally, I start to get this interest in skin symptoms. And I try to spread the information because, you know, now we have more and more. And if you have been to my Instagram page, you know, I'm thinking a lot to that. And it's not just for, you know, for nothing. It's not for fame. I'm not going to publish. It's not for money. It's just because I think it's very interesting and it's brand new and it's helpful. And I see a big enthusiasm among the medical community and also in the general public about this because we are speaking since a month about an invisible enemy. And this is why I like to say that this invisible enemy can be visible on the skin. You are dermatologists, I'm plastic surgeon, so we are very visual doctors. And we like the before and after. We like things that are visual. And this is a very important, you know, sign, help, if 20%, because this is the rate of COVID plus patients, are having skin symptoms. And even more, 1 week before the respiratory symptoms. So it's a big luck, I would say. So the message are, if you are noticing something new on your skin, whatever is it, I make a classification in 5 types, maybe you have seen it. Actually, only the 3 first types are relevant for the diagnosis. Number 1, all, you know, the vasculitis, you know, lesion due to the inflammatory storm. We have made, of course, rashes, but we have also some other manifestation like urticarial vasculitis, some petechia, some livedo, sometimes chickenpox-like lesions. So you can see everything. Nothing is really specific. You can see, and it's very quite common. You know, we call it the infectious rash, like we see.
It's erythema multiforme. We get it with virus infection. A lot of times with virus infection, we do get this kind of rashes.
Yeah, exactly. So
virus eruption.
Yeah, I'm not sure to understand exactly what your question, my friend, but let me just continue on this this sign. So I found immediately, intuitively, very helpful for everybody, doctors and patients, to have this this information, this awareness. So basically, the first message of this COVID skin, you know, awareness is if you have something red, blue, spots, something difference of color, white or blue, whatever, in your skin, be very careful. If you have a bit of fever, if you have a little cough or some shortness of breathing, it can be a COVID, and it can justify a test. So the message is very simple. It's very simple.
Exactly. And I think a lot of times when you do have infection, there will be a standard of viral, and it's like we generally, even if you get rashes before, and I think it's good if you kind of and be more visible.
Exactly.
I think that is a great take-home.
Absolutely, absolutely. I 100% agree. But it's not enough, Ting Song. That's why I move forward, and many of the patients I were in contact report me something very specific for me. They were very pale, you know, very white, and sometimes also bluish. So I start to wonder, is it the same or is it different? And now it's clearly different. The vasculitis explain all, you know, the red symptom, let's say, but the cyanosis, you know, the hypoxia of the skin, which reflects in, you know, skin pallor, blue lips, blue tongue, blue fingertip, blue tooth, is a different physiopathology and more specific to SARS-CoV-2. And this is the purpose of my last post, to explain that this virus is not, you know, really targeting the lung. This is a big mistake that we doctors are doing since a month or two, that we are thinking that this is a lung, disease. No, it's not a real typical pneumonia. This is an oxygen failure, not, a respiratory failure. And that's why we have sometimes, this doctor saying, we don't know what's happening. We cannot control the death. In 1 hour, people are dying. It's completely, out of any principles. And this is a new disease. This is even a wrong disease, but actually not. It's just that the mechanism was not understood. But now we know that one of the targets of this virus is the hemoglobin. And this is the big difference between central hypoxia and peripheral hypoxia. And that's why putting this high pressure ventilation, because there is an hypoxia, very often kill the patient. So now everybody start to understand that we have to be very, very, moderate on the ventilation and use other targets. One of them is definitely, the anticoagulation, because not going too much into the details, but this peripheral hypoxia and this specific, action of the virus on the hemoglobin is, inducing, leading to a cascade, a physiopathologic cascade, and one of them is decimated thrombosis. All the post-mortem autopsy has shown, spread, diffuse thrombosis in both big vessels, like in the lung, and small vessels, like in the skin. So that's why anticoagulation is very important. And again, another thing, Tim Song. From France, months ago, we received this information: don't take anti-inflammatory. It was actually, it was the first signal was from Toulouse. Maybe you know Toulouse in France. This is where Airbus is built, fourth city in France. So one professor of infectiology of Toulouse said, we had some young patient, 25 years old, with very severe COVID. And the common point between all of them was they took, non-steroid anti-inflammatory. So there was this information. If you have some flu symptoms, don't take anti-inflammatory. But now we know that it's exactly the contrary, because this is an inflammatory storm.
Exactly. It is a cytokine storm. And what you have described all this is when the cytokine haywire, it is all the going on, and there's a lot of things going on. I think you're right.
So this is very important. And I give you another example. Many people, they take steroids for, chronic disease. And apparently, there is no any patient with long-term steroid treatment having this COVID. For example, people having rheumatoid arthritis or lupus, they have already steroid, and sometimes also hydrochloroquine, Plaquenil for lupus, for example. And they are not going to COVID center. They are kind of protected because they are protected on this inflammatory storm. So I think it was very important to make the big difference between the vasculitis due to the inflammatory storm and also the hemoglobin, attack by the virus. So there are really these two different mechanisms explaining the different symptoms. So it's COVID-1 and 2. And COVID-3 is just drug reaction. So it might be not so relevant for diagnosis, but actually yes, because we know that we have many adverse cutaneous drug reaction, ACDR, and you cannot conclude to a COVID skin type 1, for example, exanthem, like a red rash, if the patient has medication. So I put this COVID skin 3 in this classification for the help of the diagnosis as a differential diagnosis, right? And just finally, COVID skin and 4 and 5, they are a little bit, out of topic. They are more, iatrogenic. COVID-4 is more just to include that we can have, some dermatitis, contacts, or allergic dermatitis with sanitizer, excessive hand washing, gloves, latex gloves. So it's part of the spectrum, but a little bit different. And number 5, the pressure sore, and it's also a gate to speak about skincare, because pressure sore, of course, by mask, for example, or by prolonged lying position, is a little bit out of topic. I agree, but don't forget I'm plastic surgeon, so I wanted to put a little bit of plastic surgery in this classification because precious sores usually are managed by us. So, but it was also a way to highlight the importance in skincare, the COVID skincare, and maybe as you are dermatologists, we could conclude by some tips and tricks for our auditors on how to take care of your skin now during this COVID pandemic. So do you have some tips and tricks, general or more specific, Tim Song?
I think everybody's at home right now. And especially where it's drier. Of course, in terms of people on a normal skincare, I think in terms of having a good moisturizer and also sunblock is important. But try not to use too much. Try not to overdo it, just like medication. The one thing that currently there's a lot of panic going around. Everybody is stocking up Calitra, Avigan, hydroxychloroquine, and even people are actually buying medication and self-medicating.
Yeah.
And I think this is not the time to do so.
Absolutely.
Because I know a lot of people are worried, want to be on prophylaxis, but I think you might have more problems with drug eruptions, with complications, with medications. I think the best thing is still universal precautions.
I fully agree. I think this is a very strong message that we have to repeat. Automedication, you know, is absolutely contraindicated, especially with this strong medicine as, you know, hydrochloroquine. There is no indication to take a preventive treatment. The only prevention is to respect, you know, the containment and social distancing, wear mask, gloves, eyes. There is something that we didn't discuss, Tim Song, also the eyes. Eyes can be, you know, a door for infection.
Mucous membrane,
Yeah, exactly. And it can be also a sign. Some conjunctivitis has been reported. So it's not just about skin. It's also about mucosa, the mucosa of the lips, of the tongue, of the conjunctiva. So this is, it's true. You caught me, but I wash my hands before. Maybe we can. By the way, it gives me the opportunity to speak about something about the gloves, because the gloves, you know, it's still a debate. Should we wear or not gloves? Well, for me now there is no debate anymore. You can debate, but for me, gloves are absolutely mandatory when you go out, of course, when you go out. But you have to know how to wear gloves, because, you know, if you don't use them properly, it's completely, you know, useless, and it can be even counterproductive. So we all know that before to wear the glove, we need to wash 20 seconds or put the sanitizer. But I want just to give a little tip for our auditors. If you want to remove the gloves, after going to the grocery, for example, you wear your mask, you have your gloves. So how we remove the mask, how we remove the gloves. So first of all, always, of course, start with the gloves. But you have to respect a sequence. And you know that surgeons, we used to wear gloves, and maybe you have seen some tutorial online how to remove your gloves. So you need, I cannot show it because my second hand is busy, but you need to put, let me try like this. You need actually to take the gloves by inside on one, and then you with the other one, you make a ball, and the outer of the gloves, outer aspect of the glove will be inverted inside. So this is number one. Number two, you need to wash. And number three, you need to remove your mask. And you need, of course, you don't touch your mask on the front. You touch your mask on by the attachment here. And then your mask in the garbage. So you need to respect this sequence. It's very simple. It's 3 steps. First of all, the proper removing of the gloves, then washing your hands, then the gloves. 1, 2, 3. And I think personally, this is my recommendation. I don't know if you respect that, But
yeah,
if you go out,
it's
if you go out, if you go out, you have to put, you have to wear gloves, and of course, you throw them. You don't use them, because I received one of my message of my friend. He said to me, when I use gloves, can I then put sanitizer and use them again? No, no, no. Don't be cheap with gloves.
Exactly. I think
throw them and,
yeah. Health is more important. Health is more important. Yeah.
Yes.
That's a great tip. That's a great tip, because a lot of people do not know, and we also when the first thing they take away the mask before the glove, and also there's things that you touch before you actually, and especially people when you take it off, they don't wash their hands and they start rubbing here or doing anything, and things that you touch, even if it's on your face, are contaminated. So I think that's a good point. Taking things away, and I think now we are looking into maybe at one day we all have to wear a face.
Yeah, this is mainly our future. I don't know how it's going to end, but definitely this is a risk. Let me just do also a little comment on the mask, because now this is the big big stuff, the mask. Very often still, despite the fact that it's now 1 or 1 month and a half, there are still question about the mask, and people, they want to have the same mask than the healthcare workers. So I want to be very clear, guys. You have to understand that you have 2 types of gloves, of masks. Sorry. I would say, first of all, the surgical mask. The mask from surgeons. You have maybe this. It's in to out protection. Imagine, I'm a surgeon. When I'm operating, I don't want to contaminate my patient, which I'm operating. Okay, but it's not protecting me from the patient to me. So if you wear a surgical mask, which is the easiest, mask to find, despite the difficulties, you are not safe yourself. You are safe for others. The second type of mask, the facial protection, FFP, 2, 3, etc. They are doing the opposite direction. It's when, for example, there is, a fire. And you want to avoid to inhale the smoke, you need a protection from out to in. So this is the purpose of this FFP mask for healthcare frontliners. They are at risk of being contaminated by the patient, so they need out to in protection. So it's not justified for general public to use a FFP mask, because it's not just having the best mask possible. It's just about having also ideas of what is available, economics, economic also consideration, and it's unrealistic that to provide to the whole planet FFP mask, and also because it's not bilateral protection. So basically, if you want to be safe, you wear a surgical mask, which is easy to find. We don't have a problem here in Dubai. Everybody, I think, is able to find mask, at least simple mask. So surgical mask from the in and out, and for the out to in, just social distancing. So if you combine surgical mask, SM, and social distancing, SD, you have a bilateral protection. So don't expect the FAP. Just do SM plus SD.
Very good point there. I think most of the time you think wearing mask is to protect yourself, but I think what we are doing here in Asia is that we want to protect the whole community as a whole. We play a part not to spread to the others. And
we have to turn over. We have to turn over.
And the take-home message is exactly. And I think the take-home message is, and to treat as if everybody is asymptomatic area from now on, and we be very vigilant in terms of taking care of that. And I think because of time, we end here. But it was so great talking to you. So glad you're safe. And we need to catch up and discuss more. I love your quality.
Thank you, my friend. I want just to conclude by some words about you. I want first of all to thank you for your invitation. It's always a pleasure. I want also to make a little announcement for your meeting. Hopefully in August. So in 4 months' time now, we will have the ADACK Kuala Lumpur. I hope, cross finger, that we will be able to go there. It's still a little bit, of course, blurry situation, but I am quite optimistic because 4 months' time now, it's quite significant, and I think I will follow your invitation because I have the pleasure to be invited for the second time to this ADACK Kuala Lumpur. So if you are a doctor, I really invite you to join this world-class meeting to be held on August 14 and 15 in Kuala Lumpur, and the chairman is our host, Dr. Tim Song. So we cross fingers for this meeting, and generally speaking, for everything, we need to go back to normal life. Personally, I don't expect anything before June, but yes, inshallah, we will have a good summer from July.
Exactly. Thank you, my brother. I hope to see you.
My pleasure, brother. Bye bye to all our auditors. Greetings from Dubai, and the message: stay safe and take care of your skin. Bye bye.
Take care.
Bye bye.
Bye.
Bye bye.